Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia.
Good morning.
Good morning to everybody.
Good morning.
Good morning.
Доброе утро.
Доброе утро. Guten Tag.
That's
Guten
Russian.
Tag.
That's Russian in case people don't know. Okay, so what?
That's Chinese to me.
Chinese. So you don't have, that's interesting. You have a lot of different denominations, but you don't have anybody who's Chinese.
No.
Not
We
yet.
used to have some Korean.
Right.
Yeah.
You have to look
Yeah.
for some smart
We have
Chinese.
Vietnamese.
Okay.
We have Vietnamese. So we have some Asian.
Oh,
So,
yeah, you have Asian,
there you
but we
go.
have to find someone who's Chinese. Okay.
Yeah.
So the topic today for your
Men's hair.
men's health.
Yeah, you know how everybody's growing their beard or the mustache. I'm growing the hair in my nose, so I can. I'm a
about in your
doctor.
ears, your
I'm a
nose and
doctor.
your ears?
Yeah, my ears and my.
My
I'm just
ears.
gonna let those hair grow and.
Men's
Richard,
health.
Richard is growing his mustache even bigger now with
Yeah, no,
November
that's
November
right.
Men Health
Yeah, men's health.
awareness.
Okay, so it's awareness. So are
You
men
know,
aware?
men's. It's interesting because lots of time you get men that come to the office and they are like their arm is twisted by their wife or their significant other that will come in and say, you have to go and get checked. You have to go and get your blood test done. And then you wonder why women live longer than men. And usually women take better care of themselves when it comes to preventive care. So, we need to, as men, I live by myself, so I'm very independent. And I think it really comes down to the personality of the individual. If you are a dependent person, so you have to be told what to do, when to do it. If you are an independent person, then you take initiative and you take off. The best relationship, they say, is the codependent. Well, I depend on you, you depend on me, I help you, you help me. They say that's the best relationship.
It really is.
That is the best relationship. But regardless, you should not be forced to go and see your doctor, take care of yourself, do your blood test at least every 3 months if you take medication, or every 6 months if you have concerns regarding your health. And there's so many things with men's health. For example, breast cancer.
We're talking about men's health.
Right. When we hear breast cancer, we think, I would say women's health or men's health. Well, men develop breast cancer. And we just had a gentleman last month that came in with a lump in the breast. And immediately we did the ultrasound. It does not look good on the ultrasound, the image that I received. So I contacted the surgeon to see the surgeon. And he went berserk. Oh, my God, why nobody told me to do this? So, we always bring awareness. And this is not the first time we have mentioned, for men to check their breast. Now, women check their breast every month because of the hormonal change. Men don't have to do that, But when you shower as a man, at least, every 6 months, once a year, during the month of November, when you shower, just palpate the tissue of your breast and feel for lumps. If you feel anything that don't look or feel normal, then go to your doctor and have your doctor check it out. And it's so simple. In the Geriatric Center, because we are so complete, we have an ultrasound machine right on the premises. So it's not like you have to go someplace else and get the test done. It get done right there. So breast cancer is something that we don't think about. Also, venous insufficiency.
I was waiting. I mean, we have to.
You
You
know.
said penis.
Well, no.
Did you say penis? What
Not
did you
yet.
say?
We're
No,
gonna
what
get
did you
there.
Insufficiency.
Venous from the vein.
Venus. I thought you said
We're gonna get to the penis. I was gonna start from the bottom up.
You
Come
said,
on.
I thought thought you said penis insufficiency, so
well,
I figured.
venous insufficiency can give you penis insufficiency.
So it's Venus, V-E-N-U-S, sorry. You can see where my mind is.
So,
I was waiting for it.
and, you get a lot of patients that they go to the doctor and they say, I cannot get an erection. And of course, they might have insufficiency on their veins that irrigate the penis. But what people need to think is that the penis, just like the heart and the lungs, and it's not an isolated organ. It's attached to a human body. So when that happens, that you are not getting a good erection, look at your legs. Do you have varicose vein? Do you have, little lumps of vein popping out? So maybe you have also venous insufficiency. And when you have venous insufficiency, those people end up getting a little bit of swollen ankle. And we tend to think usually of a deep venous thrombosis that we have, DVT. We say, maybe I have a DVT, let me go and have it checked out. When you go to the doctor and you are concerned about a DVT, it's a different test for venous insufficiency. Completely different test. And why is that important? Because with the procedure that we have, and we have brought some vascular interventional cardiology in the past that they do now with the laser treatment, those veins can be restructured so that the flow of blood from the artery to the vein back to the lung and then to the heart to get recirculated can resume the power that it used to have before. And why is that important? Because people tend to develop then ulcers in their leg and so many complications from venous insufficiency. They even end up losing their extremity. Mm-hmm. So when a person has diabetes, they lose the sensation. If you add to diabetes that you are losing sensation, you have venous insufficiency or peripheral artery disease, then those are the combination that usually is the perfect storm to lose an extremity.
When I listen to you about all this, and I'm thinking that most men probably don't look at their legs as women look at, because they have a lot of hair.
I look at my leg all the time.
You look at your hairy leg.
Especially when I'm going to shave.
Well, that's one thing
but
about...
I won't shave this month.
That's one thing
month
about
of November.
Gay men, that they do shave and they have gorgeous
shave,
legs. It's true.
And they look,
but,
and they
right,
usually are concerned.
Yes, so they can see it.
Right.
See, they can see where a man... He just assumes that, there's nothing there. Why do I have to bother? But so you're saying, and now let's get to the penis insufficiency. So you're saying that it's not necessarily mental. This is the big problem that men have always had,
exactly.
hasn't it?
And it's not age related. You are not getting a problem with erection because of your age, because you look at other men the same age as you and they're still getting an erection, then you have to say maybe there is something. We have the guest last week, stem cells for
yes, Dr. Feinerman, stem cells for erectile dysfunction.
For erectile dysfunction, and the people that do invasive vascular treatment also can go in there and look at the vein and artery to see where the flow is being interrupted and fix it for you.
But Dr. Mencia, you, of course, as a geriatric physician, you do have to prescribe medication for various conditions. So if someone is suffering from high blood pressure or something else, it does affect the blood flow to the penis.
Yes. Well, look at the drug like Viagra. Viagra was a drug that was initially looked at for hypertension.
I didn't know that.
Yes, it was a drug that was, the family of drug was look for to trying to treat hypertension. And some of the subjects that were being studied, they say, oops, where this guy came from? I hadn't seen you for years.
That's very, very well said.
Oh, you're still alive.
Oh, this is great. That's terrific.
So that's how it came out. That's why when you take those drugs, when you take those drugs, sometimes we tell the patient, you have to be careful when you stand up after you take, Cialis, Viagra, Levitra, those drugs, because the blood pressure can drop too much. And the problem with taking those medications without being properly worked up to find out why you have erectile dysfunction is that there are certain complications to taking that medication. One of them, the most dangerous one, is called priapism. And priapism is when the person get a painful erection. That means that you got an erection now, you are happy, and somebody come and put a handcuff at the end of your penis and will let the blood flow back. But the blood's still flowing in. And it becomes such an emergency that if you don't run to an emergency room or to a doctor to inject to counteract the effect, you can get the penis amputated. So
because the blood is now...
it will create necrosis. It will kill the tissue. So it's very painful, and it's an emergency. That's why, when you go and you're going to start using one of those drugs for men out there, don't go with high dose from the very beginning. Always go low and then start titrating up slowly. And don't these are the drugs that you don't want to over-medicate and say, if I take 100, what about if I take 100?
I want to back up into something because
just smiling over there.
Bill and I have talked about this now because you see so many.
My friend Bill.
Yeah, my friend Bill. But we have looked at so many commercials about Cialis and Viagra and all this.
And the bathtub.
Yeah, and the bathtub at the end. But years ago.
But I look at the commercial with the bathtub.
I love the bathtub.
Let me interrupt. Yeah, but why two bathtubs? Why don't merge the two things and you get closer together?
Oh, absolutely. That's a very good point.
Yeah,
they
you
missed
can
the
sort
boat.
of play.
You're right. They just couldn't go that far. They went very far, but that would
because
have been
people will start using their imagination.
Yeah.
What they doing with their hand inside the bathtub?
Exactly.
Let's go back to Bill.
No. I just want to ask you. So then. This must be something that if they're putting all that money into commercials, these companies, this must be a major problem. When you're dealing with people who come into you as a patient, is that something you discuss right away?
At the right time, not right away, at the right time. Usually with the patient, when they come in, they need to create that rapport with you. So you wait to build up the rapport with the patient. And sometimes the patient, they come because that's their chief complaint.
But
I have problem getting an erection. Or I'm going to start dating and I'm not sure if I'm going to be able to perform.
But a lot of that is also mental. They may be able to
There is a huge psychological component. So, and that's why people, because of that, they go and they ask for a drug, and a great percentage of time it will work, but still they have to get checked.
Yeah, but I want to pursue this because I think it's a very important issue nowadays. We always thought that men who are over 60, 70 had the problem. Now they're talking about men who are 40 having the problem. Why is that true?
Well, stress. You get a lot of younger men now going to the hospital with chest pain, and it's all stress related. The quality of life of our society has risen the level of stress so much in business and people trying to make ends meet, the drop of the economy.
Penis? So why does that affect?
The stress, because if you are overstressed, in order for you to have a sexual relationship, you need the mind and the spirit. You need to feel love. So it's a feeling that gets involved. It's a whole
it's the ambience.
Universe. It's the ambient. It's a different universe, and you need your whole body. A woman can make love reading a magazine. A man need to concentrate on what they're doing. So the men need more of that psychological backup than the women. So,
well, I want to jump into something. It's all like this, but prostate. So, what does the prostate have to do with a man having? Is that just ejaculation, or is that a sexual feeling? I don't understand the two of them.
That's a good question, because the chandelier, the testicles, is what Richard remembered.
Oh my gosh, where do you go to chandeliers or testicles?
I have a
Don't tell me about your testicles.
I have a patient that was having a bilateral inguinal, groin area hernia repair. So he said, "Doctor, I'm always listening to you, and I believe in you. I trust you so much more than my surgeon. Anything I should be concerned about?" I say, yes, I'm going to tell you the most important thing. Right after the surgery, take your hands, touch your chandeliers, and make sure there are 2 of them, that they didn't remove any of those.
Oh, that's really scary.
So he said,
That's
okay.
really scary. You mean you've heard of that?
No.
Oh, you're just
it was a
kidding.
joke.
Oh, I'm
It was
sorry.
a joke.
Oh, my God.
so-
Okay. Okay.
So the testicle, the chandelier, produce the sperm, and then those sperm will travel into and be underneath the bladder and go into the prostate. So the prostate is a path that they use, and through the prostate, then you ejaculate. Now, remember, the prostate is like the lumen that goes through the prostate is a triangle. One brings the urine, because, we use the penis to urinate too. So one channel is the urine and the sperm, and they meet. So sometimes a person can ejaculate, and instead of coming out of the penis, it can go into the bladder. And that is usually because the prostate is enlarged at the base, and the sperm are going in the wrong direction. And then when they pass urine, the sperm will come out in the urine. So the
That's
prostate,
a very good explanation, because a lot of that does happen.
A lot happen
They
to-
call it, what is it? It's ejaculation.
retrograde
yes.
ejaculation.
And what is that caused from? It just,
They're just the penis is like an apple.
yes.
The prostate is like an apple, and at the base of the apple is the lumen where the 2 lumen above it have met. So if you have, let's say, enlargement of the base of the prostate, then that lumen is not allowing the fluid to come down. It's going back up into the bladder, because there's no sphincter stopping one direction. There's no traffic light. So
So it gets confused.
it gets
so why
confused,
is
and
that doing that?
it just follow
But it doesn't really matter.
follow the path of least resistance.
But if you're not going to wanting to have children, it doesn't matter.
It doesn't
Are
matter.
you still
Well-
getting the same pleasure?
Well, no, because again, remember, there are feeling involved here. So when the men ejaculate,
I see.
you see the ejaculation
Yes.
come out. You feel you have accomplished. You feel that you have ejaculated, but you don't see anything. You say, "What happened? I didn't really ejaculate," but you did.
Do
It
men
just
know
went-
about this? Do men understand what's happening?
A lot of men don't know.
It's ever
No, a
been
lot of men
discussed.
don't know. They think they have a problem. They think it's psychological, that they have ejaculated, but physically they didn't. But it's impossible.
And then the
that
women
means
that they're with,
the women
wonder
feel like,
what's
"Oh,
going
you
on
fake
here."
it."
Yeah,
The
yeah,
women
you're
feel,
faking
"Oh,
it."
you fake it. You fake it that you ejaculated."
Oh, that is really interesting.
You say you were coming. You say you were coming. I'm waiting.
Now that is really an interesting subject.
It is a very
Because,
interesting subject.
And this must happen then to older men because of prostate.
Older and younger men. And in younger men, it's very, very important to get that check, because if you have a cancer of the prostate at the base, it will block that lumen. So in a younger man, you don't expect to have enlarged prostate at the base. For the baby boomers, they start buying motorcycle and riding for many, many hours. If you take a motorcycle rider and check the PSA, which is the level of the hormone that produces the prostate, you check a PSA, and then you put it on a motorcycle for 3 or 4 hours, and then you go back and check that PSA. There's an elevation on PSA, because the prostate, and I usually tell my patient, if they ride motorcycle, they go to the doctor, the PSA might be higher than baseline because of the fact they went to the doctor riding a motorcycle.
They now have bicycle seats that have openings.
Oh, I thought they have the prostate.
That's
for
right.
the prostate to sit. And
Exactly.
the chandeliers.
Yeah, the chandeliers, because you see these people bicycling all over the place,
Right.
and it has to affect them in
Right.
some way.
Mm-hmm.
Unless
Absolutely.
they're kind of sitting up off the seat.
Right.
But a whole, this is the whole subject. When you said people come to see you, and you said you wait a while, when you first started we started the show. You talk about it's a natural. It's part of your body. It's like your arm, your leg.
Absolutely.
But it isn't in a way, because it's where the men, especially, think of themselves. They all think of
that's
themselves.
manhood. That's manhood.
Yeah, that's manhood. That's where, in fact,
Right.
you have these young boys, and that's the first thing that's so
It's
exciting
like
for them.
a woman losing the breast. That's
Oh,
womanhood. So
absolutely.
it's that's
Absolutely.
manhood, and talking about our friend downstairs, sexually transmitted disease are rising in the geriatric population, including HIV. Including HIV. So, you still, here, for those people that live here in South Florida, for the snowbird, when they come here, they want to have fun. You have to be very cautious on who you're dating and using protection. And if you care for yourself, there is absolutely nothing wrong if you start meeting a new partner and you go out for dinner and you decide you're going to start going from dinner to bed. Let's go and get checked. Let's go to Dr. Mencia. Let's have a full STD workup together. And then we can check from HIV to simple viral infection that will get those herpes infection. They give you the lips, and at least you prepare now. Because the same herpes viral, this herpes viral 1 and 2, there's one that affect the lip and there's one that affect the genital area. So if you get a full checkup, when you're going to now have a sexual intercourse, that's one less stress that you're going to be having with you. You say, I know my partner is clean. And then you can do anything you want to in bed.
But that's a very, very important point. But I better give you your phone numbers because time is running out here. AGI Medical and Dental Centers. That's the name. AGI Medical and Dental Centers. A lot of you are familiar with their center on Commercial Boulevard. And the phone number there is 954-489-1345. Men, if you're listening, go get yourself checked. And okay, now we have another center that they opened in Boynton Beach on Hagen Ranch Road, and their number is 561-270-6494. And the greatest thing is that Dr. Mencia and his staff are open on Saturdays. At least they're open in Commercial. Are they open in Hagen Ranch Road?
On Saturday.
On Saturdays. It's absolutely amazing. So, and the other thing that's really important, home visit services are available for homebound patients. You're not going to find this anywhere, everybody. So,
and Dr. Garcia will be there as of Monday.
That's
at the Boynton office.
You're right. The
rheumatologist.
Who is brilliant. I loved her.
Brilliant and
smart.
Beautiful woman.
Beautiful and brilliant, and they do a lot of dental work. They do everything. Why don't you just go there for a tour? But Dr. Mencia, I wanted to end the show. We have 1 second to end it. But thank you very much for covering the discussion on men's health, because it's not common. People don't talk about it. But when you go to Dr. Mencia, just tell him what's going on, and he can help you in so many ways, not necessarily with medication. Good advice.
Yes, absolutely.
Yeah. Thank you, Dr. Mencia.
You're
it was
welcome.
wonderful being here with you again.
Always.
And, of course, and Ina.
And
Ina always there to help us. When I want something done, I call Ina.
That's right. Yeah.
And we'll be back right after the show.
Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.